morning to everyone. So today is actually important topics. It is, the cervix. What is cervix? Lower part of the uterus. That is, what is anatomy? Last class, cylindrical shape. Anteriorly, posteriorly, there is. And last class I described everything about the cervix and screening of the carcinoma cervix. কে বলতে পারবা ক্লাস ক্লাসের এটা কি কি ছিল স্ক্রিনিং? পেপ স্মিয়ার আর ভেরি গুড, ভালোই পড়াশোনা করছো, থ্যাংক ইউ। So today carcinoma, actually at first let us see what it is so common complaint problem of the patient about the cervix lesion of the cervix. What is discharge so common? Leukorrhea, that is called leukorrhea. Then pain in the lower abdomen, pain in the back, all are related to cervix, problem on the cervix. So naturally if you think that what are the problem of the cervix, what are the 5 important causes of the disease of the cervix? Number 1, infection. Number 2, trauma. Number 2, neoplasia. Number 4, congenital some anomalies. And number 5, miscellaneous. Okay? These are the common pathological problem of any organ. So basic thing you should know so that you can describe at any time, any point. Now, at first there is patient. Now I am going directly to the cervix. Cervix, there is normal anatomy and anatomical shape, size, normal function, secretion, that is. So pathology means some changes. Suppose inflamed, that is swelling of the cervix. So what are the causes of the swelling of the cervix? At first we think that maybe some infection, but most of the time not so common infection. So that is some tumors of the cervix uteri. That is, what is tumor? What is the definition of the tumor? Any swelling, in sense, any swelling. That is swelling, but it is not benign, maybe not benign, maybe not malignant. So swelling of the cervix is suppose enlargement of the cervix, congenital hypertrophy of the cervix, then some Nebautian cyst, and then what are the others? What I wrote? Endometriotic cyst, and then neoplasia. Okay, and others. What are the other hypertrophy? That is enlargement, congestion, and edema of the cervix. It is so common in pregnancy and also related to some diseases. Suppose prolapse is associated with enlarged congestion and edematous change of the cervix. Also in the pregnancy there may be some change. Okay, so now I am going to at first to the carcinoma cervix. That is today's topic. Usually what patient comes to us, it depends upon the patient's symptoms and sign depends upon the stages of the disease. Stages of the carcinoma cervix. What are the different stages? 1, 2, 3, 4 different stages. And in early stage, this is asymptomatic, and in the later stage, that is symptomatic. So, and symptom sign depend upon the lesion of the cervix and stages of the cervix and associated with other infection or other things. So, number 1, if we go to this slide, what are these? Irregular uterine bleeding, commonly from coitus and staining at stool. Then pulse-smelling discharge. Here about the vaginal discharge, that is, what are the nature of the discharge? That is watery discharge or blood stain discharge. তারপর brown watery discharge. That is rice watery discharge. চাল ধোয়ার পানি বলে এটাকে, rice watery discharge অথবা brown watery discharge. That is the one of the symptom of the carcinoma cervix. If it is especially in the advanced stage. Okay, another, suppose the organ affected, like it is in advanced stage, if the bladder involved, rectum involved, then the symptom sign depends upon the stages. Like if bladder involved, there increased frequency of micturition, incontinence like this. Maybe sometime in advanced stage fistula is formed. If there is fistula is formed, uterovesical or uterocervical fistula, then continuous dribbling of the urine and rectal pain, backache like this, all are depends on the stages of the cervix. So what are the signs? That is signs there is in exam that is asked. There is 5 cardinal features of the carcinoma cervix. What are the hardness, fibrillity, then bleeding on touch and fixed to the surrounding structure, fixation of the surrounding structures, and these are the most important cardinal signs. These are, so you should remember these points: hardness, fibrillity, fixation, and bleeding on touch. Okay. Then diagnosis, biopsy from the cervix on the histopathology. Now before that, I want to show you the stages, staging of the cervix. Stage 1, 2, 3, 4. Okay, stage 1. Just stage 1 is related to the confined to the cervix, and only it and body. That one. Stage 1A. Stage 0 is that is pre-invasive carcinoma cervix, not usually seen by naked eye, and that is stage 1A, 1A2. That is also microinvasive form. A1 is that is less than 3 millimeter in depth and breadth is 7 millimeter. A1. A2 is more than 3 millimeter in depth and more than 7 millimeter in breadth. That is A2. And stage A and B. B is limited to, that is on inspection we can see. That is macroscopic. To say up to less than 4 centimeter is B1 and more than 4 centimeter of the growth, then B2. And okay, then these are stage 1, A, B. So then another is stage. What is this stage? It is, you see, it is endocervical growth. It is, we can see this one. So B and C is that is it is growth extended to the paracervical tissue, but not to the pelvic wall, not like this. Pelvic cellular tissue means here. So stage 2, that is here paracervical tissue is affected and but not up to the pelvic wall, and also extended to the vaginal wall. This is vaginal wall. So stage 2 B, stage 2. So paracervic only to the cervix and then vaginal wall. B1 and B2 is extend to the cellular paracervical tissue. Then another is stage 3 is up to the pelvic wall. If it is extend up to the pelvic wall, then it is stage 3. And if it is involved the bladder and that is rectum, then it is stage 4. Okay, this is whole vagina is affected, and this is paracervical tissue is affected, and this is posteriorly extended. So this staging, how it is advanced, how it is progressive, the disease how it is progressive. I will come again in the staging. So that is direct extension, lymphatic permeation and embolism, and through blood flow, blood vessels. Directly, suppose these are all directly. And stage 4 is metastasis to the distant organ. Okay, so that is stage 4, the blood, lungs, bones, mostly lungs. It goes through the blood vessel to the lungs and also to the skeleton of the body. And that is stage 4. Okay, so distant metastasis. These are distant metastasis. It goes to the chest, lungs, bones, like this, and also breast. Okay, now, so main basic is stage 1 is limited to the cervix, stage 2 is it extends to the paravaginal tissue, paracervical tissue, stage 3 extend up to the pelvic wall, and stage 4 is that is for A is bladder and rectum, and for B is distant metastasis. So this is the basic thing, huh? And so you can draw the picture and so that you can memorize all, okay? Now direct metastasis, lymphatic metastasis, and then blood vessel metastasis. Okay, now what are the actually causes of this carcinoma cervix? Any cause? Okay, so in a poor socioeconomic condition, one of the important cause, poor. Why? The personal hygiene may not maintain malnutrition like this, and infection, human papilloma virus, and what you told already. So you know about this, and then this is some investigation. I go to the back again. How can we diagnose the carcinoma cervix? So cervical biopsy and cytodiagnosis, and others. What are the others? No, MRI not usually. Cervical biopsy is so important one. Cytodiagnosis, colposcopic guided biopsy, and others for ultrasonography, some assist on MRI, that CT scan, and MRI told. But for the staging, we should do so many things: cystoscopy, proctoscopy, chest X-ray, IBU, all should be done for the staging. But for the clinical staging is important. Clinical staging. What carcinoma cervix is usually clinical staging. That is, we examine the patient and we do some investigation for diagnosis. But in ovarian carcinoma, surgical staging. After opening of the abdomen, we do staging. Here, so that cervix we can easily see, we can easily examine, so we can do the clinical staging under general anesthesia. Under general anesthesia, we can do the clinical staging of the cervix. So how can we do inspection, pars speculum examination, bimanual examination, rectal examination, and also we saw that through the fornices, we assess the involvement of the pelvic cellular tissue or uterosacral ligament or any other ligament affected or not. So by the bimanual examination is so important under general anesthesia.